Welcome to the Brilliant Fertility Podcast. I'm your host, Dr. Katie Rose, and this podcast exists to help illuminate the path ahead of you. With expert interviews, clinical pearls, and real client success stories, my intention is to bring you hope for what's possible on this journey and to give you tools and resources to navigate the ups and downs on the road before you. If you find this podcast helpful, don't forget to subscribe on your favorite listening platform. And I have a big request. If you have a minute, can you leave us a 5-star review? And let us know, what did you learn? What did you come away with? Did you leave with that spark of hope? This helps more people like you find the podcast. My mission is to support as many humans as possible on their path to become parent. And by you sharing and subscribing, you're part of that mission too. And I'm so grateful for you for being here. Welcome back to the Brilliant Fertility Podcast. In today's episode, I'm talking all about energy medicine, acupuncture, and how these can have an impact on fertility. I had my own recent sort of aha moment around this recently as I was in the midst of doing an acupuncture treatment with a patient. I'll tell you more about that story later. But one of my other fertility patients who's been receiving acupuncture for a few months now requested that I cover this topic on the podcast a while back. So this is in part for her and for all of you who have had questions about acupuncture and fertility. So just a little bit on my background. I am a licensed naturopathic physician, and the naturopathic program that I went to included training on acupuncture, and we did have to take a separate set of boards to practice acupuncture. And for me coming out, I felt confident in traditional Chinese medicine, pattern recognition, and point prescription when it came to general health. It took me several more years of training to really feel confident about using it for fertility. And what I find just so amazing and fascinating about traditional Chinese medicine is that it's based on the individual and their patterns. So you could have two people who have the same Western diagnosis, say they both have endometriosis, but in Chinese medicine, their patterns can be different. And this just allows us to really customize their prescription in a way that gets them even more powerful results, which I just absolutely love. I mean, that's part of why I do what I do, right? Is because we want to approach these people as the individual they are. So after 11 years in practice, conservatively, we've calculated that I've done at least 11,000 acupuncture treatments. And fun fact, my mom is actually an acupuncturist. She went back to school at 52 years old after practicing for 25 years as a licensed pharmacist in a hospital. And just seeing how frustrating it was to see the same patients coming through the hospital time and time again, and the issues that they would have with the layers of prescription, and they're taking one prescription for this problem, but then they're having a side effect from that drug and they're needing another drug to combat the side effects of that drug. And she was just so fed up with seeing that. So I do have a little bit of bias in how much I love acupuncture. It's like the family business now. And my mom also went to specialty training in fertility for acupuncture as well. So we can have really fun conversations about these patterns and how they support fertility. So for those of you who are completely unfamiliar with acupuncture, it is an ancient medicine that has been around for a minimum of 2,000 years. And the documentation that they have going back in Chinese medicine goes back even further, but it uses very, very, very small sterile needles to access points, and these points reside on a meridian, and the meridians flow the length of the body. So we have meridians that run the length of the arms and legs, and then we have meridians that run, the front and the back of the body. And by accessing these points, we are accessing energy. And when we have a well-designed point prescription, where we're using, several different points on different meridians of the body, we can balance the energy. So we can allow for excess energy to be released. We can allow for tonification and harmonization of energy. And so, for example, for someone who might be struggling with endometriosis, I'll keep that as our example, we might see an underlying pattern of blood deficiency contributing to energy stagnation. And that stagnation is associated with pain. And so when we use points that relieve stagnation and support the building of blood, and herbs are usually used in combination in a scenario like this, then we can see this smoothing of the chi being the energy, and a gradual reduction in pain symptoms and potentially improve fertility outcomes. Now, with the research that we have on acupuncture for fertility, there's been a lot more research done in China because they're actually using acupuncture in their hospital systems there. A lot of their reproductive health centers include acupuncture. That is just part of the standard model of care. Whereas here in the United States, most acupuncture clinics are standalone, although we are seeing more and more openness around using acupuncture in fertility treatments and clinics recommending treatments, and even a handful of clinics in the United States having acupuncturists as part of their practice. And I hope that we all live to see the day where every fertility clinic includes an acupuncturist, because the results that I see in my patients who have been completing acupuncture treatments leading up to IUI, IVF, embryo transfer, overall, we see improved outcomes, and the research backs that up as well. So physiologically, what is happening with acupuncture? We see an increase in blood flow. So when we use local points, for example, the points that we might use like over the ovaries, over the uterus, when they've done Doppler ultrasounds after an acupuncture treatment, they've seen up to a 60% increase in blood flow to these organs. And that's really important, right? We want good blood flow coming to these organs. When we get good blood flow, we're getting more nutrients to these organs. We're nourishing the endometrial lining. We're nourishing the follicles that are growing. And we're able to more effectively carry waste products away. We also see a reduction in stress hormones, like cortisol. And we've seen reductions in prolactin when using acupuncture. Prolactin is a hormone that is most often associated with breastfeeding, but we will see it often moderately elevated in people with endometriosis and people who have high chronic stress. And then we'll see it, much more so elevated in people who have a hyperprolactin, a prolactin producing tumor called prolactinoma. And acupuncture can be used really successfully alongside Western medicine to reduce prolactin and regulate menstrual cycles. So when I have someone who's coming to me for fertility, I'm almost always going to be recommending that acupuncture be a part of their care plan, because we do see such a reduction in overall stress and improvements in their cycle. And oftentimes other symptoms that they may not have associated with their struggles with fertility, but are part of all of this underlying pattern. Because again, Chinese medicine is looking at the whole person. So if you have someone who's got this underlying pattern of, damp phlegm accumulation in the lower jowl, that might be like an example we see with PCOS. Then they may also have some digestive symptoms. They might also be having heartburn, bloating, frequent bowel movements, almost like IBS type symptoms. And it's highly likely that they've been labeled as IBS and just told it's just something that you'll have to deal with from time to time. You can take an Imodium if you need to. You can take some Prilosec if the heartburn gets too bad. But we have other tools for this, and other tools that don't have side effects. And that's one of the things I love about acupuncture is yes, there's always a risk when you're putting a needle in someone, that if that needle is not placed correctly, that you could, hit a nerve, or, there's even horror stories of people who've had a collapsed lung, unfortunately, in situations where maybe someone needed a little bit more training. We see that actually more with physical therapy and dry needling. That's a whole other tangent that I probably should not be going down at this moment. I personally have never known an acupuncturist who has experienced a complication like that in a patient. I've never had a patient who's experienced a complication like that. Every once in a while, I will have a patient who has like a little bruise after a needling, because sometimes we'll hit like a little capillary or something, but the needles are so fine. They're so much smaller than, say, a needle that you would be having an injection from, like if you've gotten B vitamins or other injections. So they're very, very fine. I am considered a gentle needler. A lot of sports medicine acupuncturists, they might be a little bit more aggressive in their needling style. I don't see the need for that. I haven't seen, a clinical difference in using any more aggressive needling styles. The whole point is that we are able to access that well of energy. And this brings me to, what my aha moment was. There's a common conversation that I have with patients about acupuncture and accessing that energy. I always recommend that they set intentions before we go into a treatment. So what is your intention for today? Yeah, we know we're preparing for this egg retrieval coming up or this embryo transfer coming up, but how do you want to come away from today feeling? Is there a question that has been really lingering on your mind that you are hoping for an answer to? Because what's really amazing about acupuncture is it essentially puts us in this trance-like state, this state where we have this, field of openness, this access to higher self and source energy. And in fact, there are what are called source points that we can use in acupuncture to help us, receive what is meant for us. And that's something that I just find so profound and powerful about these tools, is that it's not just a physical medicine. This is an energetic medicine. This is a spiritual medicine. And I had a patient this past weekend who was feeling a little anxious because she has a retrieval scheduled for November. She would love to be able to have weekly treatments, but due to childcare and work schedule, it's going to work out that she can usually come every other week for treatments. And I said, you know what? That's okay. Like, we don't want to be creating a situation in which you feel like you are less than, that you're not doing enough, where there's stress around feeling like, oh, I'm not going to be able to do enough, so this isn't going to work. In fact, we can create this same energetic state because our body holds the memory of these treatments. Our body knows where these points went, even if you don't consciously remember where I was putting these points. So if you can get yourself into, position where you're lying down, you've got the bolster under your knees, you put some meditative music on, and you breathe and you set the intention the way we've been practicing before our sessions, you can access this state, you can access this energy. And I sent her home with some acupressure points that she can be using for herself in preparation as well. And I use a lot of acupressure with the Brilliant Fertility program. We have a module in the program that covers acupressure and the most helpful points that you can be putting pressure on for improving reproductive health and cycles. And it also dawned on me that, gosh, with this intention setting that we can do around energy, we have so much more opportunity to be influencing energy in a positive way. So what I've proposed to my Brilliant Fertility program clients, and we're all getting really excited about, is that with the start of this fall's cohort, which will start September 17th, will be actually including a weekly remote energy healing session. So as I get to know our new participants in this cohort and what they've been struggling with, what their underlying TCM patterns might be, that I can actually help support that movement of energy in a positive direction. Because at the end of the day, we are all just a bundle of vibrating cells. We are vibrating at a certain frequency, and that frequency is energy, right? So we have more influence over our energy than we are often led to believe. And with tools like acupuncture, it feels so productive, right? To be able to go get your needles in and feel that. I mean, it is almost essentially a high as you come out of acupuncture. You've got a lot of endorphins circulating, and it can almost become like a dependent state, like thinking like, oh, well, I have to go get acupuncture to feel that way. And that's not 100% true. And I know this might seem crazy because you're like, wait a second, but how else can I access that? And why would you be telling people this? Like, this is how you make your livelihood. But at the end of the day, my goal is to empower people. And not everyone has access to acupuncture. Not everyone will be able to budget to do this 1 or 2 times a week, every single week. And so knowing that you have this power within you to change this energetic pattern is really empowering. And so I'm really excited to start introducing more energy work within the Brilliant Fertility program. And I would love to answer more questions that you guys have about how I've used acupuncture in practice, and any other questions that you might have about acupuncture or traditional Chinese medicine. I would love to support with another episode on this, a part 2, doing some interviews with some of my mentors who I've learned, how to support fertility even better over the last 10 years of practice, and anything else that is coming up for you around this. If you're listening to this episode in the first week of September 2024, like I said, our next cohort of the Brilliant Fertility program starts on the 17th. So we are getting our enrollments in this week, and this cohort will take us through the end of the year because it's a 4-month program. So when it comes to getting support through the holidays, which is often the most difficult time of year for couples who are trying to conceive, you've got the holiday parties coming up, you've got the gatherings, the questions, the baby announcements that you might be anticipating getting from friends or other family members. And this can often be a time when we almost just want to retreat and isolate. And while that's really understandable, I want to invite you into the opportunity to do things differently this year, where you get support that you need from people who understand exactly what you're going through. So keep an eye out. Check the show notes today for links to learn more about the Brilliant Fertility program, to learn more about what that support could look like for you. I've also got some discovery calls that I'm doing with people this week, and we've opened up some times over the next few days for that. So if you're listening to this in September, the beginning of September, and this has been on your heart, then know that I am here for you, that you don't have to do this alone. And there's just so many other ways of looking at this picture than likely have been offered to you yet. Okay, let me know what other questions you have about acupuncture, about energy medicine, about traditional Chinese medicine, about the Brilliant Fertility program. I am here for you guys and sending you so much love. Thank you for listening. Thank you for taking a moment to leave a review. This helps get this podcast in front of more people who need help. And I appreciate you all so much.